on our expected penetration and our market analysis. So this is everything we have so far, and thank you so much for listening to us, and please join us in revolutionizing healthcare.
Thank you. Very nice presentation. Could you comment on the clinical history box? Who enters that? The patients themselves or the doctor?
So we will have a minimally trained nurse. We usually in triage in Hamad or Sidra, they put a highly trained nurse to do the triage. Usually that nurse works for 8 to 12 hours. Over here, any nurse can write in the chat in the history, similar to like how we'd write something into Chat GPT, and then they would type in, oh, the patient came in with headache since 3 hours ago. Quick typing. That's it.
But why you're not leveraging the waiting time to let the patients enter self-reporting?
Because the problem is every patient explains things in a different scenario. We would still wanted to have medical terms to help this algorithm to understand, especially at its initial phase of deployment.
So in this system, you don't have self-reporting.
No self-reporting. No, it's entered by a staff member.
And in terms of the validation, what's the sample size? You said it's you validated it using data from HMC?
No, we didn't validate it. We're predicting so the triage time in Hamad currently is 30 minutes before when a patient walks in till somebody tells them how urgent their case is. So based on this assessment, which will take 3 to 5 minutes maximum, we will cut down the time by 85%. Okay. Before a patient knows whether they have to go to a health center or can stay to get admitted.
What's the first study you'll do to validate that your approach works?
So we will have to deploy the system first of all in the further away satellite emergency departments in Al-Wakra or Al-Khor, because they have less critical cases coming in. Then we would want to see how much time this system, like how quickly this system triages patients versus how a normal nurse would triage the patients. Then we would do like a randomized control study where one patient would come in with this system triage and one patient would come in triaged by a normal human being, then we would compare them too. So we'd have to have randomized control proof of concept studies because this is not deployed anywhere except at Johns Hopkins around the world.
I think you should ask, Dr. Khalid.
Okay. So in a society where all your patients are avatars or robots coming into the system, I imagine that it would be very straightforward to deploy something like this. In a society where a patient demands to see a doctor, regardless of what the damn triage system says, I imagine it will be more challenging. So have you thought about how to enforce that, or how to get people
to buy into the idea?
To buy into using this system rather than to go directly to, I want to see the doctor right now?
So as we said initially, first of all, the proof of concept, we want to always have a human have a final say whether he accepts or rejects the clinical acuity score based on the CTAS guidelines. So after that, if the patient still demands to see a patient, especially at the initial phases of deployment, the patient is always right. In the end of the day, if he genuinely feels that he's in pain or in trouble, then we will of course override the system. But the majority of patients, especially when education comes around that AI is taking over healthcare, and actually the study from Johns Hopkins showed that EMTS or their triage system, Triage Go, is more accurate than nurses at triage. So when these studies come around in public, people will start to buy into the system, especially when they still have that fail-safe of a human having the final decision in this case.
Okay, and just as a small follow-up, the length of the triage is actually advantageous because the bottleneck then is created at the doctor that has to see the patient, right? So if you're clearing a lot of people at triage, you're still not solving the actual downstream, the second bottleneck of when is my turn to see the doctor. So have you thought of that trade-off?
Actually, this is a good trade-off, but in terms of what the benefit is that when a patient waiting for 30 minutes has stomach pain and he's not sure of whether he's having a heart attack or not, which happens many times, people have had cardiac arrest in the triage rooms in Hamad because they haven't been triaged yet by a nurse because of that bottleneck problem. Now we will be quickly able to triage them and have a system that shows, okay, these are the people with triage acuity 1, 2, 3, then the people who came in with 1, even if it was 2 minutes before, we put them in. At the end of the day, I'm a medical student. I care about patients' lives rather than the hospital system as a whole, which can be, of course, worked on once we have systems that put people first. Yeah.
Just a quick question about the clinical history. Yeah. How are you going to get the clinical history?
So somebody will have to talk so the patient will come in, see a person, be like, I've had a headache for the past 5 hours. Then you'll write, I've had.
So that's a clinical history,
that's only what's required for the triage. So in triage, you don't take a detailed history like a doctor. You just ask quickly, oh, what's going on? If somebody has chest pain and you put chest pain here, the triage acuity is going to directly be 1 or 2.
So it's not a clinical history. It's like
It's a quick history, which is similar to how the current system works. We're not redefining the system in a way, just streamlining it. Yeah.
Thank you.
Thank you.
Thank you, Karim, for an outstanding presentation. For our fifth and final presentation from Qatar University, we have Nadine Yunus.
Hi everyone, my name is Nadine Yunus. I'm a PhD candidate at Qatar University. I'm a Forbes 30 Under 30 lister and a L'Oreal UNESCO Women in Science awardee. 3 years ago, when I had my daughter, I realized that stopping an infection is just as important as treating an infection. One day, she felt severely ill in the nursery, where we rushed to the hospital, and the doctor said she's probably having norovirus because there is a recent outbreak. The doctor said you don't have to do the test because it's expensive, time-consuming, and it's not very accurate. Just make sure she is well hydrated for the next couple of weeks, and she will be okay. Because of my medical background, I know how norovirus can spread and how quickly it can cause an outbreak. I decided not to send her back to the nursery. But imagine if I don't have any medical background, imagine how many parents would still send their daughters and children to the school where they can cause spread of the infection or even outbreaks or even closure. Especially after the COVID-19 pandemic, we saw how important rapid tests could be. That's why I thought, why till now we don't have a rapid test for norovirus? So norovirus is the main cause of acute gastroenteritis. It is the #1 cause of foodborne disease outbreaks worldwide. It's known as the cruise ship or stomach bug. So as you can see, every day in the news, you read about norovirus outbreaks in restaurants, in cities, in the US, in cruise ships, everywhere. But till now, there is a problem with diagnostics. So norovirus is highly infectious, causes large number of outbreaks. The virus remains contagious once you get infected for over 2 weeks, and it can cause severe dehydration and death if you are immunocompromised or a child. So with no vaccine or treatment available, the only way to stop norovirus is through good diagnostic tools. There is some existing diagnostics such as ELISA and PCR. However, they are time-consuming, labor-intensive, expensive, and require large equipment. Especially if there is an outbreak, it will not be very applicable. That's why we offer NOR-test, which is a rapid diagnostic tool, which we get the results in 10 minutes. It's sensitive, and it is quick and low cost, and also it is semi-quantitative. So in NOR-test, we utilize European fluorescent particles, and we use this small reader which can be used with a battery. So basically you do the test and you read it with the cube reader and you will get the results in 15 minutes. So now you ask about the competitors. So we have 2 major competitors which are Korean companies. They offer also rapid tests for norovirus using fluorescent particles. However, as you can see, the readers only cost $3,500. And for the BodyTech competitor, they cost $1,800. For our cube reader, it's only $600, including the shipping to Qatar. But also the price of the test is 2 times lower than the price of our competitors. Also, one of the competitors is the PCR BioFire kit. However, last month it was recently recalled because of the high false positivity rate. So because we don't only care about the cost, we did a validation testing compared to our competitors. So as you can see here, we collected almost 200 samples. SD biosensor only showed 50% invalid results. If you get a kit for 30 tests, 15 tests was invalid without any clear reason. Also for the BodyTech, as you can see here, the sensitivity was 55.6 because they showed 22% false positive results. As you can see here, our NOR test, the sensitivity is 96.2% and the specificity was 100%. So for the market size, every year 60 billion are lost because of the loss of productivity because of only norovirus. In the MENA region, it costs $40 million. As for in Qatar only, it costs $4 million. So our revenue stream will be through licensing and partnership, and also through the sales of the kits and the service fees for the cube reader. So this is the team. My professor, Dr. Ghayas Nasrallah, and Dr. Hadi Yassin from Qatar University. This project is in collaboration with the University of Houston, so these are my supervisors as well. I'm Nadine Yunus, and Laisa is our tech expert. So I would like to take this opportunity to thank Qatar Foundation because this project is funded by the MPRP grant, and also I'm a Magistra student, awardee. So with NOR-TEST, we are creating a future with outbreaks can be stopped before it even starts. Thank you very much.
So I have a very quick question to you. First of all, very good job. And number two, so on how many blood samples you've validated the result that you have, like you showed us?
So we collected 200 samples from people suffering from gastroenteric virus. We did the PCR and we confirmed that they have. So 40 samples were positive for norovirus, and 160 samples were negative for norovirus because we needed to compare with controls as well. So total 200 samples.
And is the samples are enough to validate?
Of course, we are trying to increase the validation process, but for now, we only did on 200 samples.
How much you need?
Sorry?
How much you need? How much samples you need?
We usually for the validation, we usually aim for 400, 500 samples, and that's it.
Nice job.
Thank you.
It wasn't clear to me. What's the sample that you need? Is it blood or saliva?
Fecal samples.
It's a stool sample. Okay.
Yes.
Okay. And then, so the question is, we all get stomach bugs, right? It's a normal thing. Usually after a day, it's gone. So what's my incentive to go and test for norovirus? As a person who has a stomachache, why would I want to go and test myself?
So. Norovirus, it differs from the rest of any foodborne virus because it can, in immunocompromised, it can lead to severe dehydration and it can cause death. However, it's not that severe because most of the cases are self-limiting. But the problem is it is very infectious. So especially in restaurants, that's why it's called the cruise ship virus, especially in restaurants. And if the food holder is having norovirus, it can cause an outbreak and infect everyone. That's the problem.
So the idea is to start testing people as they enter a cruise ship?
No, if you have, if someone on a cruise ship showed symptom of food poisoning, you need to test him to make sure if he's having norovirus to get quarantined and stop working, so not to spread the virus.
Can I ask a question about the technology? So where do you have the competitive edge? Is it the reagents? Is it...
Yes, so we thought about doing a patency for our test itself, but then we decided because we have a trade secret and we are the only one who knows how to do the test, so no need to do the patency and to cost money. But the patency is in the strip itself, the sample pad we are using. That's why, because fecal sample cause a lot of problem. That's why there is non-specific binding. And also in our buffer and also in our particles that we are using. And all of this we adapted to the cube reader, which is commercially available.
So some of the tests you described, they also claim more than 90% accuracy.
Yes.
So to go from 90% to 15%, because in one of them you reported 16, how do you know it's not a... how did you validate that it's not a mistake in your lab rather than... because it's commercial and from 90 to 15%, it's easy to
We
spot.
did their validation with the PCR test, the gold standard. We didn't validate their test with our test. We bought their test, and we tested our samples the one we have in our lab. We did the PCR, and the PCR was also done in Hamad, where we got the samples, and then we tested their test.
But did you do this independently?
Yes.
Have you validated this by independent people? Have
No.
you given the kit to Hamad and say, can you just take our kit and test it and compare the results to your own results?
Actually, one investors, they are Chinese company, they want to adopt our test. So now we are trying to adopt our test with their reader, and then they will take our test and they will do the validation by themselves. But this is the first Qatari-made rapid test, so we would like to keep it in Qatar and to get it registered under the Ministry of Public Health. So this is our next step. Thank you.
Thank you, Nadine, for an informative presentation. We have concluded all 5 presentations, and we've asked our judges to deliberate and decide on the winning presentations. I'd like to take this opportunity to extend our heartfelt thank you to each and every one of our finalists. Your brilliant presentations truly showcases what RIA is all about. So I think they deserve another round of applause, please. While we await for the panel of our panel of experts, I would like to invite Mr. Haytham Ali, Director of Collaboration Platforms, to demonstrate our exciting portal, a platform that exemplifies the forward-thinking spirit of QRDI.
Thank you, Noor. Assalamu alaikum. Good afternoon, everybody. And welcome to the second time we present the portal. First time we did launch this a couple of days ago, and we're very excited to share with the audience, with you guys, what we have been working on. So QRDI portal, this is the previous name. So what are we calling it now is InnoLight. So InnoLight is the innovation lighthouse. We are hoping that it will light up the RDI ecosystem in Qatar to be able to create further collaborations among the ecosystem, the stakeholders in our ecosystem. And it's nice to see some of our early champions in the audience as well, some of the very first supporters of the portal when we did it as well. So the QRDI portal main component around resources that are available in Qatar. These are the infrastructure, entities, labs, facilities that are available for not only researchers, but also for the private sector, innovators, and for the government sector as well. The second component, major component, is the opportunities. These are the funding opportunities, training opportunities, jobs and internships that are in our ecosystem that we curate from the ecosystem and we publish them in one place to make it a one-stop shop for the whole ecosystem to leverage. Then an exciting component again on the portal is the insights. These are the dashboards that we are presenting in the ecosystem from KPIs and indicators in the ecosystem that also are hosted in the portal. And the last is the community platform that we launched back in September. We are trying to create communities around researchers, innovators, and policymakers in government around sectorial topics that we have. So we launched the Biomed and Health community in November. We'll be launching in April the digital tech and sustainability and energy communities. So let's see how the portal look like. So if you scroll down on the homepage, seeing our motto, connect, collaborate, and create, the first section will be the opportunity section, where the user will be able to navigate or to filter by if they're from a specific sector or user groups. If an SME interested to find the programs that they're available to or they can apply to, they can find it from here. Our academic, of course, from the research centers in Qatar and whatnot. Or they might opt just to explore all and go directly to the homepage of the opportunities to see all of the rest of the opportunities. Following that, you'll be able to see the resources section. And this is all the beautiful resources we have in the country. When we started this journey with the portal years ago, we started only with 24, 26 entities. Now we have over 384 entities from all over Qatar. These entities, not only academic and research centers, but also we try to curate the entities from the private sector. These are the companies that are in Qatar. Either they have some infrastructure to share, or they are in need of resources that they could collaborate with. So we would like, and we started also to curate all the startups in Qatar and the small and medium companies that are into digital tech, and create a profile for them, and then later we can go into one of their profiles to see. In addition to the entities, we also are exposing the expert profile, the expert and talent in the country, that are in the country, and they use one, they participate in one of our projects, whether it's research projects. So those projects, the people who worked on those projects, we have funded over 4,300 projects in the ecosystem. These are the people, those 7,000, most of them worked on those projects at one point or another. The portal is a national platform. So our aim is not only to showcase our offering and our funding, but also any funding or any program or any projects from our ecosystem. So we have around 500 projects that from our entities in Qatar that they have worked on from either external funding, not QRDI funding, or from their own funding. Okay? These projects have produced great outputs. They produce more than 13,000 publications. They have over 1,000 patents, and they've deposited close to 900 data sets. This is in addition to the equipments, the services, and the facilities that are available. We can show in a minute. One thing to mention, these are not numbers we just curated as statistics. Each one of these elements and these numbers has a full profile behind it. You can fully access it. Okay? And I'll show you that in a minute. This is our insight section, and it's divided into 3 strategies that are relevant, starting with the Qatar National Vision, the NDS3, and our own QRDI 2030 strategy. You can have links. You will see links inside. You will be able to see the full documents. And this is just a link. This is an image of the section of the analytics, where you can also view all these beautiful dashboards, and you can see it inside. And the last section is around our own publications, our QRDI publications. And we have 3 in the makings right now around generative AI and research, universities Drive for Innovation Entrepreneurship in Qatar, and the Advancing RDI Talent. And watch out for those publications very soon. And the last section is, sorry, the mouse is just keep acting. The last section is the community project I just mentioned. And we can start by clicking and going directly into the community project. This page explains what's the community and what's the objective of these community, and what is the benefit of joining our communities. Again, communities are a great place to network, connect with like-minded individuals in the sector. So when we did the Biomed and Health, it was a very successful event attended by 260 professionals in the health sector, not only practitioners, but researchers and people from the industry as well. And we were also had guests from the Ministry of Health and the relevant policy makers in the sector. So as I said, these are the communities we launched, 2 of them, the research and IP management, the Biomed and Health, and we'll be launching the digital and the sustainability and energy community in April, inshallah. Could go down instead of going up. Go to the footer and you'll be able to access the same thing from here. So I'll access the opportunity page. This is where all our funding program, our training program, our talent opportunities for scholarship, for GISRA, for instance, We'll be able to find it on here, but it's just worth mentioning that since we started, we have received 22,000 proposals for funding. We have awarded 4,300 that benefited over 10,000 talent. These are students, researchers, and innovators from the private sector. And even in the training or capability building program, some of our government sector as well. So these are samples of the entity that benefited from our programs or participated as opportunity owner in some of our programs. So if you go down, you'll be able to access individual pages for our business innovation, scientific research, or talent programs. Or if you decide just to go down to the filter, you'll be able to see the full programs from here. The loading is taking a bit some time. Web Summit internet is just overloaded, I believe. Thank you, Mohammed. Thank you. We have a very beautiful filter on the left that can filter for you based on your user type. If you're a researcher, a student, a talent, or if you're interested in a specific scientific area, you can filter from here. So each of our programs have a dedicated page that's similar to this, that tells you overview, introduction about the program, and some highlight about the program related to funding, duration, cycle, any eligibility criteria, or if there is any specific research area that this grant funding training is interested in, you'll be able to see that. You'll also be able to see who are the eligible user groups could apply or participate in our funding. If you scroll down a bit, you'll be able to see the timeline with indicators that tells you when will the proposal close, when you get word when the award is announced. Very soon as well, we'll be adding a tick to remind you. If you're interested, you can get reminders about the programs. So all of our funding programs, they work in a very similar way, and it's very similar pages. Let's go next to the resource section. This is another interested section that as mentioned before. This is where we curated these entities, the labs, the equipments, facilities, and the profile of the individuals. If you scroll down, you will be able to see over 7,600 experts in Qatar that could be leveraged to extend invitation to participate in your team, or if you're just interested to view their experience, expertise, the work that they have done, you'll be able to click and navigate individual profiles as well. When you just hover the mouse, you will see connect with me. And this is one of two actions, call to actions that are available in the portal. So the main aim of the portal is for people to connect with each other so they can collaborate, right? So when you click on that, one of two things will happen. If you have a profile and you're logged in, you'll be able to send a message in a very similar way to LinkedIn to the other side, and they will entertain your message and then respond in kind. If you're not registered in the portal, we'll ask you to register. Simply, we need to take that information and send it to the person that you're requesting to connect with. You can also click on the profile of the expert, and then you'll see their full details, some of their research profiles that you can also look at, and their interest areas in RDI. And if you scroll down, you'll be able to see the project that they have worked on, the publication that they have produced, or any other output they have produced. And you'll be able to click from here and to go into those details as well. So each project will have its own page that gives you a bit details about the project, some abstract, the team that worked on the project, the collaboration from other institutions on the project, and also some parameters about the project, whether it's open, closed, and which institution. But the beautiful thing is, in this project has produced 30 publications, right? So from here, you'll be able to also see those 30 publications. So the whole portal, the resource on the portal are connected to each other. So you can go to an entity, you find out in the entity the people work there, the project that was awarded to the entity, publication that was produced there, the equipment, lab, services, facilities, collaboration that's there in the entity. So I can honestly say this InnoLight portal is one of its kind. We have done our work and our survey to benchmark. In the GCC, in the Middle East, it does not exist except this one. This is as of today. Tomorrow, if we get copied, great, no problem. So from here, we can go back to resources. And on the top, we were just browsing the expert and talent, and we just seen also the projects and output. Let's see the entity and see how that looks like. So we have two different types of entities. We're contemplating whether to call it entity, organization, or what to call it exactly, because it's a university. We capture university, research centers, companies, government organizations, entities. We capture everything. So we called it entities, but it's for us, it's either RDI entities or business entities. And these are the companies or the private sector or the industry that we are trying to capture as well. So I'll just give you two examples here. I typed in Qatar University, but I'll select Hamad bin Khalifa. So Hamad bin Khalifa, for instance, this is a view of the page for the entity. This is how it will look like. It gives you some statistics around what's available at this entity, some bio. You can connect with the entity level, or you can go at the bottom to see what do they have to offer. This is the institutes, the colleges, but also the labs, the services, and the infrastructure that's available in these entities. So the connect with us works at the level of the entity or the lab or the equipment, or you can connect with an expert regarding a project, publication, or an invitation that you would like to extend. That's from the research side. But from the business side, we also capture the profiles of startups, the profile of, I was trying to see one of the entities that was actually present in the podium at one point, but this is just another example of an entity. So the benefit of a business sector, why would you, as an owner of a company, why will you benefit from listing here, is we have some programs, for instance, like the CASIP program, where a company from Spain need to join a company from Qatar to collaborate on a research proposal so they can get funding. So this will be an ideal way, as a repository of these companies, they will be able for people to search and find their counterparts. I'll go quickly just over the Discover page. This is a nice visualization that we have picked, where you can slice and dice and find out about opportunities. What do we have in terms of the opportunities and the resources in a specific sector? So this is in the medical, biotech and health. When you click on that, the numbers at the bottom filters, and then you can see the specific programs. So this is, in a nutshell, the InnoLight. I invite you to visit and search, and hopefully you'll find something great. And I believe the announcements is almost here, so my segment is done. Thank you.
Thank you, Haytham, for an impressive demonstration of InnoLight. As we welcome back our judges, we eagerly anticipate their verdict. But before we proceed, we would like once more to thank them for their contribution. And by that, I would like to invite Engineer Umar Al-Ansari, Secretary General of QRDI, and Senior Director Aisha Al-Madahka, Director of Innovation, to present our judges with a token of our appreciation. Professor Hilal Lashwal. لا مستر ماجد. دكتور خالد. On behalf of Mr. Mohammed Al-Imadi, Sheikha. Thank you. So this is the moment we've been all waiting for. The results of the first cycle of RIA. And I'm gonna see the results with you guys. So, in second place, we have Sharia Advisor Chatbot, Fazler Sharif from Hamad bin Khalifa University. We have a second runner-up, so we don't actually have a third place. So the second runner-up is Karim Fanous from Well Cornell Medicine in Qatar. And now for the first place, who's it gonna be? Nihal Ashaq from University of Doha for Science and Technology. Congratulations. We would like to announce that one of our awards is an internship in one of QRDI's startups. Congratulations to all our winners. Your creativity, passion, and dedication to innovation is truly remarkable. And best of luck for everyone. And I thank all the participants. The participants are esteemed judges and everyone that supported us in this remarkable journey. Thank you. Can we have like a group photo? The winners as well, please. Yeah. Can you have all the participants? Yeah. Can you have the participants, please? The 5 participants. Congratulations, everyone.